Welcome to the 3x5 news, views, and reviews scribbled on index cards. We get in and we get out fast, so keep up. This broadcast is titled How All of Us Need Medicaid. Its subhead, like we're not sick enough already? Open quote. Grotesquely cruel, unquote. That's what Paul Krugman calls the cuts to Medicaid that Republicans are using to fund tax cuts for the rich in the budget bill. Did you ever wonder why so many Republicans are okay with low tax rates for the rich? Of course, those who don't follow the news are unaware of this. Those who are aware may just accept it as a price to pay for all the supposed benefits that the Trump administration will bestow on them one day, someday, in their lifetimes. For others, of course, it's, well, we're just glad someone is beating the tax system. If they were rich, and there was a rich person laying dormant in many Americans, as in, if I won the lottery, if they were rich, they would be happy to be the beneficiaries of tax cuts as well. Americans, not just moonshiners in the Ozarks, have always and will always hate revenuers. Before I continue, I know this is kind of a desperate look, but I have no shame. Kind of like Republicans, right? Well, here goes. Anybody who leaves a comment on my video will not only receive a comment back, but whether you're a thoughtful person or a troll, I will subscribe to your channel. While I think subscribing to YouTube channels is personal, whether you like what I have to say or really hate it, please consider subscribing to mine. Thank you. Trump et al. Are too cowardly to slash Medicaid head on, especially since they will proportionally hurt red states, the cuts that is. As Pamela Hurd and Daniel Moynihan explained in the New York Times, slightly edited, Republicans have mostly abandoned transparent cuts, such as eligibility changes or spending reductions to states, because it's easy for voters to understand that damage. Instead, they are opting for opaque or hidden cuts, which will shed millions of eligible beneficiaries by overwhelming them with pointless paperwork and other needlessly complicated administrative requirements, unquote. To begin with, the bill calls for work requirements. Let's think about that for a minute. Decades ago, work began to be required for welfare recipients. But Medicaid is not a program like old-time welfare, but provides money with which to live your life. Most Medicaid recipients are already working or, if unemployed, incentivized to work because Medicaid does not provide money for rent, food, utilities, etc. It's as if Republicans can't differentiate between the different types of public assistance. It's all the same to them. Social welfare programs trigger something that says the recipients must be lazy, a la the proverbial welfare queen. Among other things, the bill would require many beneficiaries to go through the renewal process coverage twice a year, once more than previously, because of the time and trouble involved, especially since many Medicaid recipients are individuals who might experience trouble with both the bureaucratic and cyber worlds. Many of those still eligible people would be unable to negotiate the process. In the Times article, Hurd and Moyne elaborate, quote, many lose coverage due to procedural issues such as not completing renewal paperwork, submitting incomplete or late applications, or not updating their address and missing important notices, unquote. On top of that, they may be charged copays. Even myself, who isn't poor, will put off a scan because the copay on our insurance, which is considered good, is $75. They also want to create a greater burden for states by, for instance, increasing the penalties for states that would make enrollment errors, which would incentivize states to add more documentation requirements. But I was once poor and, as well, mentally ill. I was only able to pull myself out of those situations because I was thrown lifelines. But the eternal Republican fear that somebody, somewhere, will be taking a free ride on public assistance means to them that many should be deprived of it. And of course, now they want the cuts to compensate for tax cuts for the very rich. I can't imagine human beings, if you can even call today's Republicans that, batting that equation back and forth with each other or in their heads without a flicker of conscience. Can you? A preliminary estimate from the nonpartisan Congressional Budget Office said the proposals would reduce the number of people with health care by 8.6 million over the decade. It's not only individuals who will experience hardship, but hospitals and clinics, especially in rural and inner city areas, which will lead to higher charges, complete with the ripple effect of job losses in the community in healthcare and retail. So what becomes of people who are either removed from or are no longer eligible for Medicaid? Some may qualify for subsidized health insurance through the Affordable Care Act marketplace, but this means plunging again into bureaucracy and trying to make sense of it, or equally difficult, trying to figure out who to turn to for help with the enrollment process. Think about that. Who do I turn to for help with the enrollment process? How many of us have all wondered that? The medically uninsured will forego checkups and doctor visits in general. Instead, many will wait until they are seriously ill and then throw themselves on the mercy of the ER. By law, hospitals are required to serve anyone regardless of their ability to pay. Then the hospitals will bill these indigent patients from thousands to hundreds of thousands of dollars, which they have little chance of collecting. Though those on disability are protected from creditors, others will find their meager funds garnished. The only consideration that those not covered by health insurance will have is that when they die, however prematurely, they won't have to pay their hospital bills.